anthropologist from Gordon. He and Mary are at Chelsea Flower Show and enjoying a nice sunny day there, I think. I think Gordon has worked very hard recently, and I think he deserves, in a sense, a day off or a night off anyway. So he asked me last night if I wouldn't mind stepping in. So you've got me by want of Gordon's invitation. Our speaker this evening is Professor of Food, Families and Society, Rebecca O'Connell. Welcome, Rebecca. A very brief introduction to your talk, because I think you can tell us more eruditely than I can from what I've been reading about your good self and your work. But against a background of, in the UK today, there are over 4 million children who live in households without adequate access to nutritious food. This has been Rebecca's concern for some time, and currently so, and she would like to tell us more about it and what it means and what we can perhaps do to help the situation.
Thank you so much for that lovely introduction, and thank you for inviting me. It's really good to be with you this evening. So yes, as you said, I'm Rebecca O'Connell, and I am a Professor of Food, Families and Society at the Centre for Research in Public Health and Community Care at the University of Hertfordshire. So this evening I'm going to talk about some of our research that I led on children and food in low-income families in the UK. So the project that I'm going to talk about was a much larger study that was funded by the European Union and carried out by a team of researchers in 3 different countries when I was at the Thomas Coram Research Unit at the UCL Institute of Education prior to joining University of Hertfordshire in September. But I'm just going to focus on the families. Oh, if I can just move the slide. There we are. I'm going to give you a bit of background, talk about what we mean if we're talking about food poverty, how do we define that? I'll talk a bit about the context now and the context in which we designed and carried out the research. And then the main part of the talk this evening, I'm going to focus on the UK and particularly on children that we interviewed and what they told us about their experiences of growing up in families on low incomes and their access to food and their lack of access to nutritious food and what this meant for them at home, at school and outside of school, and how they made sense of their experiences. And then I'll finish up by saying some of the kind of policy implications that we came up with based upon our research, and also a few points about what you and what we can do as individuals and collectively. Okay, yeah, and then hopefully we'll have plenty of time for discussion. So do make a note of any questions you have as we go through. So first of all, what do we mean by food poverty? So it's in the news a lot. Well, there are differences in the ways that poverty and food poverty, or household food insecurity, as it's sometimes called, are conceptualized, how they're defined, and how they're measured. But at the heart of any definition is a lack of access to sufficient food for health. But in addition to this, most people recognise that food is never just food. It's never just nutrients. So the anthropologist Audrey Richards, and I'm an anthropologist by training, the anthropologist Audrey Richards puts it, food requires a series of values other than those which hunger provides. So what she means there is that its food is really steeped in meanings. It's very meaningful, and it meets kind of social needs that are beyond those that are biological. It's very symbolic. It's an expression of who we are. It mediates our relationships with other people, and it's a measure of a person's worth, their status. So this is kind of recognised in the definition of household food insecurity that the Food and Agriculture Organisation, the FAO, adopts, which says that food insecurity is being unable to consume an adequate quality or sufficient quantity of food for health in socially acceptable ways, or the uncertainty that one will be able to do so. And these kind of different dimensions are captured in our national statistics on household food insecurity. So, such as those gathered by the UK's Family Resources Survey. And they conceptualise food insecurity as being like a spectrum from very low food insecurity, in which people have an absolute lack of food, you know, going without eating perhaps for a day or more, to marginal food insecurity, which includes worrying about whether you're going to run out of food before you've got money to buy more. So in this analysis of the households below average income data set from 2019-20 that was done by the Joseph Rowntree Foundation, you can see that apart from single adults, it is children who are most likely to be living in households with low or very low food security. But actually the situation has got worse since then. And the latest survey by the Food Foundation in January of this year found that 3.7 million children were living in homes without adequate access to nutritious food. That's nearly 22% of all households with children, and that's doubled in the last year. And among the reasons for this are massive rises in fuel and food costs that we're all noticing and that have hit the poor the hardest. So when we designed our study in around 2013, there was very little research on the extent of food insecurity among families in the UK, or any research really on the experiences of children and young people themselves. And we set out to address this gap. At that time, the global financial crisis, so-called austerity measures in some countries, and rising food prices were leading to national and international media reports of increasing demand for food aid, families choosing between heating and eating, and children arriving at school hungry. Sadly, we are living in the midst of another perfect storm, and the research is just as relevant now as it was then. So our overall research question was about what difference social contexts and social positionings, so being an adult, being a child, being a man, being a woman, what difference they make to the extent and the experience of food poverty. And we set out to address this question through a comparative case approach. So we selected 3 countries, the UK, Portugal and Norway, to provide for a contrast of contexts in relation to conditions of austerity. So the UK and Portugal had both been subject to so-called austerity measures by the government, and Norway was a contrasting case because it hadn't, and it's a relatively more egalitarian and wealthier country. We thought about reality of being sort of existing at 3 levels. So we thought about the macro context of international and national policies. We thought about the meso level of local areas and schools. And we looked at the micro level of individual children and their families. And we used a mix of different types of methods. So quantitative methods when we did, well, when I say we did secondary analysis of large-scale data sets, the statisticians in the project carried out analysis of large-scale data sets. And we used at the micro level qualitative methods, so interviews and photography with children and their parents. And we interviewed families, 133 families in all. And that included 45 families in the UK and I think 51 children that we spoke to. And if you're interested in the international project, this book is free to download on the internet. I'm not going to go into detail on this slide. I just wanted to show it to show that we did research at these different levels. So as I said, these kind of macro level, we carried out secondary analysis of large scale data. At the meso level, we went into schools, we spoke to teachers, we carried out observations in the local areas in which families lived. And then at the household level, we interviewed children aged 11 to 15 years and their parents. It was usually their mothers. We did questionnaires with them as well. We talked about the kinds of things they usually ate, and we made observations based on our field notes as well. So in each country, so I'm going to focus on the UK, and in each country, we had 2 different study areas. So we had most of our sample, most of the people we spoke to lived in the capital city of each country, and a smaller proportion lived in a contrasting area that was also quite deprived. So in the UK, 2/3 of our families lived in an inner London borough, while 1/3 of them lived in a coastal town in the southeast of England. And they were both areas of social deprivation that were similar in some ways and different in others. And these shaped families' access to affordable, nutritious food, and they shaped children's opportunities for socialising. So some of the differences were, rents were much higher in the urban area, but on the other hand, transport was subsidised for young people. So buses were free, and that gave them quite a lot of freedom compared to children who were living outside of London. In this area, buses were very expensive, and they had more freedom than their parents quite often, because parents had to pay for travel. And we'll see how that's relevant shortly. So how did we involve children in the study? We recruited parents and children using screening questionnaires that were sent out to schools and through other methods. So some of the research team found families through local charities, in some cases through food banks, and through being referred by other families, what we call snowballing. And all of the children and the parents that we recruited were living in families who had low incomes, so incomes below what they needed. And mostly they were in the bottom 5th of the income distribution. And they included low-paid working families, lone mothers who were reliant on benefits, and a handful of families who had what we call no recourse to public funds. So they had irregular migration status, or a clause in their migration status which meant that they couldn't access any benefits at all. And we carried out individual visits to parents and to children in their homes where possible. And we aimed to interview children separately from their parents, though that wasn't always possible because of lack of space. Some parents and children were living in just one room. So the methods, as I said, included semi-structured interviews and questionnaires, and we had some drawings that we used to talk to children and young people about their experiences to kind of stimulate discussion, what we call vignettes. And some children took photographs for us of their everyday lives and of the kinds of foods that they ate at home and elsewhere. So how does poverty affect children's food practices? Well, we know that quality and quantity of food affects children in the present and in the long term, especially their health. And given that children eat in a number of different places, we were interested in the food available to them in these different places, at home, at school, outside of school, and how they ate in these different places. So first, I'm going to share a bit of evidence on the different contexts in which children eat, and then I'll describe how they experience how they talk about these experiences and how they acted in these contexts, trying to manage their experiences and manage their feelings about them. So first of all, food at home. Most children didn't go without enough to eat, but almost a quarter of the children in the study did feel hungry at some time because there wasn't enough food at home. Others were protected from hunger by their parents, who reduced their own food intake or skipped meals. And about half of the parents did this. So if these parents weren't going without food themselves, more of the children would have been going hungry. Parents managed to feed their children by bulking out more affordable, nutritious food with carbohydrates, potatoes and bread and rice to fill them up, by shopping around to get deals and value foods, by limiting the amount of fruit. So only a third of the children reported eating fruit 5 or 6 times a week. So that's quite a lot less than, you know, children generally should be eating, and we find in other data for children in higher income groups. And also they didn't invite they didn't invite other children home for tea or for snacks. So less than a fifth of the children had friends over to eat at their home, and that was because parents couldn't afford to feed their friends. So these slides show the kind of direct and the indirect effects of poverty and food poverty on children. So this one boy, Gideon, who was 16, and his brother, Emmanuel, whose family had no recourse to public funds. That means they couldn't access any benefits because of their mum's migration status. He said, yeah, we used to eat, but now we haven't eaten because my mum stopped working, not enough food coming. We have to cope with it and not spend nothing, because if you do, then we're going to struggle even more. And then Bryony, who was aged 13, and she had a brother as well, white British family living in a coastal town. She said, you know, if there isn't enough food, we'll get it. And sometimes mum will go hungry and starve and stuff. And she went on to say that that makes them feel guilty because they've eaten what food that there is. So what about food at school? Despite all the families being on low incomes, only about half of the children in our UK sample were entitled to a free school meal. They didn't meet the eligibility threshold. So in England, you need to be in receipt of particular benefits, and you need to have a family income which is less than £7,400 per year, which, as you can imagine, you know, that's a very low amount, especially if you think about the cost of rent and so forth in London. So about half of the children didn't get a free school meal. A few of them didn't get a free school meal because their families had this no recourse to public funds clause because of their legal status. And that has now been changed. So there was a campaign about that over the pandemic, and children in those families now can access a free school meal. But at the time we interviewed them, they didn't. In those cases, some schools did provide children who weren't entitled to a meal with something to eat from their own budgets. But that depended on the school knowing that these children were going hungry, or the mothers revealing to the school their circumstances, and on the schools having enough money in their discretionary funds to do that. Most of the children said that the free school meal allowance they were given to purchase a meal wasn't enough to fill them up. And in some cases, children weren't able to choose, children who were receiving a free school meal weren't able to choose from the same selection as children who were paying. So they were limited to particular types of food or smaller items, and that was very stigmatizing for them. So this boy, Morad, who lived in inner London, he said, the baguettes, you can tell in size which one's which, but like the sandwich boxes, the triangle sandwich boxes, one's black and one's brown, and I'm allowed the brown one, not the black one. But the thing about the baguettes is that if you're not free school meals, then you get to have bigger food, which I don't see why. And also they have cheesecakes, so, but there's like the smaller version and there's the bigger version. And if you're not free school meals, you get to have the bigger version. And if you are, you have to have the small version. So eating with friends outside of school, taking part in kind of sociable activities that are generally organised around eating are really important ways in which young people in our society learn to make sense of their place in the world and how to build relationships. But around a third of the children that we spoke to had no money to spend outside of school. But there was some age, it depended on their age. Around a third said they did eat out with friends. So that included, having chips on the way home from school, for example. Chicken and chips was common in London. With friends on the way home from school. Some of them bought snacks. But the older young people said that they felt excluded from these kind of friendship groups and practices of sharing food because, you don't want to take from somebody else if you're never going to be able to give it back, kind of breaking those rules about reciprocity and expectations to be able to share food with others. So they generally would make excuses. So one boy, his mother had lost her job as a teacher. They were going to a food bank, this family. And he said he lived in an area where it was quite gentrified. So it had quite a few, it was partly, poor families and poor housing, but also very expensive new cafes. So he said his friends buy like paninis and stuff from the cafes for like £3 or £4. I just don't have that money. And then another girl, Amara, she was living in a hostel with her mum in one room. She said it's harder because when I go with my friends, for example, Starbucks or Cafe Nero or Costa, why would I spend £8 on a coffee and a cake when I could get like proper food, like food that could actually last me for a couple of days? There's no point. It affects me. Yeah, it does. But you can't do nothing. So how did it make children feel and act? Well, children aren't only victims of food poverty, they are also agents who manage to get by. So I want to finish by sharing some of the ways in which children experience and make sense of poverty and food insecurity. Well, some felt ashamed, they felt stigmatized, and they felt different. So Maddie, who was 16, explained how some of her friends refused to eat the value foods that her family has when they visited. She said, people look down on people on benefits, as her family is. She also mentioned being stigmatized because of free school meals, how the canteen system or the staff shamed them publicly by making them stick to smaller, lower cost items. And she said, so when she was talking about the lunchtime supervisor, she said, she was like, you can't get that, you're free school meals. She said, like, I was really embarrassed because people were waiting behind me. I was kind of like, oh my God. Some children concealed food poverty from their friends by making excuses for why they couldn't take part in activities with them. So Shola, who was 14, said, I have a friend that does that. they might fake a story about them going out and people believe it because obviously they don't know. It's like you wouldn't really suspect who's like you and who's not, because people are just trying to fit in and not get picked on for the way they live or the way their lifestyle is. Some other children outrightly rejected being poor. So Jordan, who was 15, said that his friends are no different from him. He said, like, they may not be like poor, but they are struggling with the hard times, because we're not poor, but we're not like totally licked with money either. Like, we're still struggling along like the rest of them, like everyone else. Some stressed that they needed to stay positive. So Phoebe was a 16-year-old and her dad had lost his job at the council, and she was confident that he would get another job soon. So she said, we're not at the point where, right, we're not going to be able to get food this week. We're just, okay, we won't be able to do this activity this week, which I don't have a problem with. It will be fine. Some other children normalised feeling hungry. So this was the case with Jimmy, who was 14. And some parents on low incomes really struggle to feed the kind of growing appetites of their growing children. Jimmy, who was 14, sometimes worries about money, and he occasionally said he goes to bed feeling hungry. He said, I think I just started growing. Like, when I started to grow, I think my belly started to grow as well. When I used to have just 2 slices of toast in the morning, but now that I'm growing up, I have to have 3 slices of toast or else I wouldn't be full. Some children said that poverty means having to grow up too fast. So Shola, who was 14, said, you've just got to learn to be careful. It's like you've got to grow up a bit too fast. So you've got to learn to take care of yourself, learn where to go, where not to go, learn how to manage money and where to buy food and stuff like that, and learn to keep yourself to yourself. Some children actively helped their parents. So several mentioned not asking for things that cost money. Others talked about how they helped their parents to search out bargains. So Cole, who was aged 14 in the coastal town, was especially good at this, finding deals, and often goes around the pound shops by himself. He and his family also pick the right time of day to look for reduced items at the supermarket. Finally, some children resisted social inequality and the advantage of some groups over others. 2 girls were especially eloquent. Amara, who I mentioned earlier, who lived in the hostel, said, we are all human beings and we should all be the same. Another girl, Faith, whose dad worked in the NHS, there was 4 children, he was a lone parent, their mum had died. She said, I think like everyone should be classified as equal. So you shouldn't feel as if you're out of the place. You feel as if you belong there. The clothes you are wearing are up to the standards. The food you eat is the same food that they eat. There's quite a lot to take in there, I think. So how did our research inform policy? What were the recommendations that we made from our research? Well, our research provides evidence to support children's rights. The right to a decent standard of living with a family income that can provide adequate, nutritious food. And to enable this, wages and benefits need to cover the cost of a diet that meets the needs for health and for social participation. The right to an adequate, nutritious meal at school. So we'd say that in the same way that children have the right to education, they should have the right to a meal in compulsory schooling. There's a campaign currently coordinated by a number of charities But, this has been argued for over 100 years, for example, by Margaret Macmillan at the turn of the last century. And children should also have the right to socialise with friends, both at home and in their neighbourhoods. These should be healthier places for young people. So often, fast food restaurants are the only places where young people are welcome and can afford to meet and socialise. Youth services and youth workers have suffered drastic cuts recently, and we need to invest in our civic infrastructure and services to provide healthy places for children to socialise. And it's especially important for children in low-income families who just don't have the space at home to invite children round and can't afford to feed them, even if they do. So I wanted to just finish off before we talk about the research by suggesting some things that you or we can do. So you can support your local food bank, and I know from your website that Stork Valley Rotary supports the Bishop Stortford Food Bank, and food banks continue to be absolutely vital lifelines in the current cost of living crisis. So this is really important, but on its own, it isn't enough. As most people who work in food banks or in research on food insecurity will tell you, food banks can help, but they can't solve food poverty or poverty. To do this, families need sufficient resources to feed themselves. So you can write to your MP, and I've put a link here, I'll share the slides afterwards, to an example letter, asking them to increase the value of universal credit. So we know from national statistics that about half of people who are reliant on universal credit are food insecure. So it's clearly not enough. You can also join action groups or amplify campaigns by sharing them on social media. For example, you can join the Child Poverty Action Group or share the UK Youth Parliament's campaign to make free school meals universal. Another idea is to show your support for groups who are campaigning for change by making a donation. For example, to the Independent Food Aid Network, who campaigned for an end for the need for food banks, or to School Food Matters, who exist to ensure that children are well fed at school and they understand where food comes from. So I should disclose that I'm a trustee of the charity School Food Matters, and they're a fantastic group who deliver food education in school and use that experience to campaign for reform on school food policy and funding. I should also say that they have a garden at the Chelsea Flower Show. So if you are visiting the Chelsea Flower Show, do take the time to look out for it. It's a wonderful, wonderful edible garden. And you can follow it on #OurEdibleClassroom. So just to finish up by saying thank you very much. These is 2 books that we wrote based on the project, and they can both be downloaded for free online. And these were the research team who carried out the research along with me. So thank you very much, and look forward to your questions if you have any.
Have we any questions?
Or reflections? It's quite a lot, isn't it? It's not a chirpy subject.
Got one question, Georgia.
So I was just asking, what reception do you feel your report has had with our government?
Thank you. Yeah, that's a good question. So I think it's had some impact, which is good. So what we did was we collaborated. So the book that I showed, the second book in the picture, called Living Hand to Mouth. Basically, I applied for a bit of extra funding to enable us to collaborate with the Child Poverty Action Group to publish that book and to collaborate on its recommendations. And we launched that at Westminster at the House of Commons, and had a really good event and got a lot of media coverage. And it was, I think it had some impact. I think it had impact in that children's voices began to be heard a bit more in the discussion of food insecurity in a way that they weren't before we did the research. And the research was also cited by Hammersmith and Fulham, who have then piloted free school meals in 2 of their secondary schools, because a lot of the discussion has been around free school meals in primary schools, but teenagers get hungry too. And so I think that's one of the impacts that it's had. But yes, I think along with, you know, the work of Marcus Rashford and lots of other people, making children's voices and children's experiences more visible and more heard, I think has probably been one of the most important impacts that we've had.
Okay.
Jim Tatchell put his hand up. Would you like to ask a question, Jim?
Yeah, thanks, Derek, and thank you, Rebecca, for coming to talk to us. That was incredibly thought-provoking and impactful and affecting. And I know that a number of people on the call today are very active, particularly in Bishop Stortford Food Bank, and as a trustee, thank you all for your support on that. But and the food bank in Stortford, along with other members of the IFAN network,
Yeah.
Has seen a huge rise in referrals into the food bank from families and everyone, really, just generally the numbers just go up and up and up, and it's kind of terrifying to hear the impact that that's having on our children, because that's lasting a long time. But that's enough blah blah. The actual question I had was, I wanted to pick your brains, if I may, a little bit on what's driving this. Have we got to this stage? It's obvious that the situation is poor and is not getting significantly better. Is it? And I was wondering, what I was going to ask is it structural or societal? And what I mean by that is it structural as in we've got really poor economic safety nets, or is it societal where people are actually also making poor choices of food, and is that being driven by the retailers? Do the large retailers bear some responsibility here because they're stocking lots of cheap, unhealthy food, and it's hard for people to get cheap, nutritious food? So which one do you think is the main driver here, or is it, have I missed some?
No, I think you've hit the nail on the head. I think it's probably both, which is not a get out, but I think that retailers do bear some responsibility. They have a lot of power in our food system, and there are calls for retailers to make sure that basic foods and healthy foods are affordable, which they aren't always. People often talk about, oh, well, it's cheap to cook, a meal from scratch. It can be cheaper. It's not necessarily cheaper if you take into account the cost of fuel and things like that. And also, lots of these families are working. So on top of working, then having to cook and having to search out bargains, that's a lot of work on top of working as well. But I think it does come down to people not having enough money. And food is generally the item in your household budget that you can squeeze, because the other kinds of costs that you have to meet are non-negotiable, housing, heating, although people talk about having to make a choice between heating and eating, clothing for your kids, all of these things. These are all costs that families have to meet, and food is often the kind of elastic cost where you can make some savings. by shopping around, by trading down, by not buying fresh fruit and vegetables, some cases by cooking from scratch. Not all of the families that we met had facilities to cook from scratch. Not all of them had access to a kitchen or fuel for the kitchen. So yeah, I think the bottom line is families just don't have enough money. And one of the reasons for that is that the DWP, the Department of Work and Pensions, has never in this country factored in the cost of food to the to benefit rates. And although wages, you know, the minimum wage has risen, the real living wage, which is calculated based on what people actually need, is higher than the minimum wage. So I think, you know, the main problem is families don't have enough money, but I do think that retailers can also do more to make sure that basic healthy foods are affordable.
Yeah, I mean, you must be irritating when you see the profits that are made by some of the retailers, when you see the numbers of zeros on the profits, and they're still making money on yeah. That's very well put, and thank you very much for your answer.
Thank you.
I was very surprised that there were 2-tier school meals. That came as a surprise to me. I would have thought that was possibly one of the things that could perhaps be remedied soonest and with least cost effect. Is it universal across the country? Is it just some councils have the right to do it, or is it universal practice? That's what I'm really saying. Or
It's a really good question, and it's quite difficult to know, because our education system in this country is so, well, and across the different developed nations, is so fragmented. So different rules apply in terms of the threshold for eligibility. So you can earn more in Northern Ireland, for example, and still get free school meals than you can in England. Age comes into it. So children in Key Stage 1, so infants, are entitled to a free school meal across the country. In Scotland and in Wales, those free meals are being rolled out for all primary school children. From September, for 1 year only at the moment, the Mayor, Sadiq Khan, has said that all children in primary schools in London will get a universal free school meal. Some secondary schools, as I mentioned, do provide a free meal for their children, but that depends on them having the budget to do that, or the local authority having the budget to do that. So it's really variable. And I think what we would say is that wherever you have this distinction in a school between children who are on free school meals and children who aren't, there's always that potential for children to be, or to feel stigmatized, or to have different access to meals. And it's interesting because some clever people who do, you know, model economic effects have looked at what it would cost and the kinds of the payback for investing in free school meals. So PricewaterhouseCoopers found that for every £1 that you invested in school meals, if we made them universal, you would get £1.70 back, really, in terms of health benefits, educational benefits, benefits in terms of productivity when those young people go on to get a job in the workplace. So actually, rather than thinking about this as being a cost, we should really think about school meals as being an investment in our children, because we're spending all this money on education. And if children are too hungry to learn, it seems a terrible waste. So that's what quite a few charities now are campaigning for, an extension to free school meals for all young people who are in compulsory education. Yeah.
Can I just follow that up? I was actually going to ask the same kind of question. To me, it seems absolutely pointless that we've gone through exercise after exercise of bringing in chefs to improve the quality of school meals, and that should not be universal to every child that goes to school. I don't know how we can campaign about this, but I mean, it's fundamental, as you've just said, health benefits from children who are properly fed. It's obvious, and also their ability to learn. And in the winter time, they're not going to be so cold if they've got a decent meal in them. I mean, I can remember, I'm old enough to remember when children in schools got free school milk, and they all got a school meal in those days, regardless of their income. And then there was no stigma attached to it. But I think there's another element too, because I understand that some children who could have a school meal don't want to have a school meal. Some parents elect not to have the school meals. So you're creating inequality in that sense as well. I mean, if you're going to do it, it would have to be right across the board that every child had the same thing.
Yeah. And that's interestingly what we found in Portugal. So we haven't talked about the international research really, but I was very surprised to learn that in Norway, they don't have school meals at all. Children take sandwiches to school, which surprised me because I always imagine that everything's better in Nordic countries, I suppose. But actually, they don't have a tradition of a hot meal at lunchtime in Norway. Children take open sandwiches with them, and actually that's very expensive for families because food in Norway is expensive, particularly bread. So if you have a number of children and you have to send them to school with sandwiches, that can mean that term time is actually more expensive than the holidays, which is the reverse of what we sometimes find here when, children, and we talk about holiday hunger here, children who do get a free school meal don't get it in the holidays. But in Portugal, they have, food is more central to Portuguese culture, and they have a system whereby all of the schools have to provide a standardized meal that consists of it's meat or fish, then rice or pasta, salads, legumes. Oh, there's a soup, fresh vegetable soup for a starter. Then all of this, salad, brown bread, and then for dessert it's fruit, or occasionally they have cooked fruit or yogurt or jelly. And everybody has that's the same meal. And then children's families pay according to their means. So there's a 3-tier system. Some families pay the full amount. I think it's about, off the top of my head, I think it's something like €1.40. Some families pay half of that, and some families pay nothing. But whatever they pay, they all get the same meal. So it's a much more inclusive way of making sure that children are fed at school. And I think, we're a much richer country than Portugal. So if it's possible in Portugal, why isn't it possible here?
Yeah, that sounds a much better system. I'm fascinated by the fact that Norway, a cold country, the children are not having a meal at school.
Yeah, apparently, I think it was since the 1960s, it just was deemed almost unhealthy to eat a hot meal at lunchtime, a different cultural tradition. So it's quite interesting. And it did surprise me because Finland is like world renowned for having a universal hot meal at lunchtime. And it's very close to Norway, but yeah, very different tradition.
And hello.
Hi.
Hi there.
Oh, sorry. I was wondering about school holidays. I think Marcus Rashford brought up this subject of children in need of food in the school holidays, because that's a disastrous time for children.
Yeah.
So have you got any comments on that?
Yeah, you're absolutely right. So we asked children and families about holiday times, and they were harder for those children who did receive a free school meal. Holidays were a time when life was more expensive. So what I remember, one girl who was brought up by her grandmother, that was a time when her grandmother ate less, and that was to not only make sure that her granddaughter had enough to eat, but also so she could give her a little bit of spending money to go out and do things with her friends, because you know they need to do things in the holidays to keep them occupied. But the government does provide funding, and in Hertfordshire, as in other places, there are what they call holiday food and fun activity clubs, in which, you know, children can go and do activities and also be provided with a meal. So that is something. But then again, I don't know whether my teenagers would be wanting to have to go to summer clubs because I can't give them something to eat. So again, I think it's something, but I don't think on its own it's enough. But at least it's something.
Well, thank you.
Yeah, thank you.
Any more questions?
Peter Barber, would you like to ask a question?
Yeah, unmute, please. You're muted, Peter.
Sorry about that. Did you find that children, in fact, are able to distinguish between what is good, nutritious food and what is attractive to eat, but in fact not nutritious? I mean, a donut, for example, is cheaper than a lot of nutritious food. Are children aware of the issue as such, and can they make the right decisions without help?
It's a good question. Yes, so I think that probably all of the people that we spoke to knew what made up a healthy diet. I think most of us know what's a healthy diet, but many of us don't necessarily follow it. And there's a number of reasons for that. I think that in the UK especially, it can be more expensive to eat healthily if you look calorie for calorie. And you see the special offers that are available on things like donuts, and they're very tempting when you're going to the checkout. And fruit and vegetables go off. So food that's perishable, food that children may or may not eat, that can be a waste of money. So often parents will go for things that they know children will eat, and that can often be the unhealthy foods that's cheaper. But some of the children definitely ate, you know, quite healthy, what we would call healthy foods, and took photographs of food that they'd made, healthy and unhealthy. There were also quite a lot of photographs of chicken and chips and takeaway. And naturally, you know, eating those kind of foods for teenagers is part of being a teenager in our country, whether that's right or wrong. Being unable to do that, being unable to have a portion of chips with your friends on the way home from school on a Friday is a way that you're excluded. It's not healthy, but it's part of what it is to be a teenager. Yeah.
Okay, thank you.
Thanks.
Any more questions?
Yes, that my question, Rebecca, was it must be extremely difficult for governments to sort of put figures on, you know, what is the amount that a family needs to actually have a minimum diet for the family, assuming, you know, reasonable knowledge of making the right decisions. So average that out, I suppose. But I wondered if during your study you made any attempt to try and quantify that, because it seems to be one of the big issues that the government has to really grapple with and build into its evaluation of what benefit package should look like.
Exactly, that's a really good question, a really good point. So yes, well, so there's a group called this. There's a centre called the Centre for Research in Social Policy at Loughborough University, who calculate what they call the minimum income standard, and this is the amount. So they basically do groups with different types of households, and they repeat this every so often. in which they agree what would be a basket of goods. So that includes foods, but other things as well, that you would need in order to live a kind of decent life. So not excessively, you know, not too many treats, but the occasional treat. Being able to buy a birthday cake, for example, for your children's birthdays, being able to buy a pair of shoes, these sorts of things. And they work out how much that is for different types of families. So they do it for people who are retired, they do it for single adults, they do it for families with different aged children, and they come up with a number. And that amount, actually, what they call the minimum income standard, is what the Living Wage Foundation used to base their estimate of what the living wage should be.
I see.
Yeah, but also quite interesting, if you are interested, is another version of that. There's an organisation called the Food Foundation. So they've just taken the food basket, and they don't, interestingly, they don't include anything for social participation. So they don't include birthday cakes or anything like that. They just think, what does a family, different types of family need in order to meet the government recommendations for a nutritious diet? So, you know, the Eat Well guide, you know, that plate that you have with the fruits and vegetables. They calculate that. I think they cost it at Tesco's. So they work out how much that is, and they can use that to say this is how much families need. And they did actually compare that. So they looked at what proportion of families' incomes that would take. And when they looked at families in the bottom fifth of the income distribution, they found that that would take 40% of a family's disposable income just to meet those nutritional guidelines for their children, which is an awful lot of your income when you've got to also buy trainers and everything else that you have to buy for kids. So yeah, it's a really
it is available.
It is available, yeah. So it could be used. It just never has been used to calculate benefit rates or wages.
It's disproportionate though if it's that amount, isn't it?
Yeah. And I think actually for the families in the bottom 10th, it was about of the income distribution, it was about 70% of their disposable income. So you can see,
no way could they afford that.
So you can see why families can't do it. Because sometimes I think it's easy to think, oh, well, porridge is cheap, you know, pasta's cheap. But actually, if you want to meet the nutritional recommendations, and it's going to cost you between 40% and 70% of your disposable income, you start to be able to see why that's very difficult. Yeah.
Thank you.
Perhaps have we one last question, maybe? Anyway, I think it falls to me to thank Rebecca very much for a very interesting and stimulating talk. I, for one, I think I'm going to write to my MP about the school meal situation. It's certainly something that I feel that I can do, and perhaps one of the cheapest things that the government could do to address the situation. Anyway, thank you very much.
Fantastic, thank you. And I'll share my slides with you so that you've got the links in there if you want them.
Yes, thank you very much.
Thank you very much.
Thank you.
Just one final thing. It's customary at the end of the talk to raise your glasses if you've got one, to toast the King, Rotary, and peace and good health world over.
Good health.
Good night,
Cheers.
everybody.
Good night.
Good night. Thank you. Take care.
Thank you very much.